Hi, good afternoon. My name is Dr. Aneesah Baker. I'm an employee here at Well Health Wellness. So today what we're going to do is we're going to tell you a little bit about chiropractic care and what we do here in our office, as well as we'll take you through a tour. So as chiropractic physicians, we work with the neuromuscular skeletal system. We adjust areas or we mobilize areas in the spine in order to bring relief to our patients. Here in this office, we do injury management mostly. We do major medical. We do nutritional care, weight loss, as well as supplementation. So what I'll do now is I'll just take you through the office. So here we have our front desk area. This is where our patients come in, kind of like triage. They come in, they get signed in, and then we transition them through the office. All right, so this office has been here about 5 years. Dr. Sadat Smith is the owner of the practice. He's been practicing almost 20 years. Here we have our supplement cage where we do a lot of nutrition. We actually advise our patients in certain supplements in order to assist with their body and natural healing. Over here we have our physical therapy room. So once our patients get to a point where they're more so, not necessarily pain-free, but where they're more so able to move around a little bit, we do a little bit of rehab. So I'm going to take this time just to stop and just talk a little bit about the transition of a patient. So first the patient comes in. They have a symptomatic area or painful area. So our first goal is to get our patients out of pain. Secondly, we move into corrective care, so we add adjustments. And part of our other modalities for pain management, we do electrical therapy, ice therapy. We do vasopneumatic cupping, which is similar to acupuncture, but we're using a cup. So again, there's just some things that we use to get our patients out of pain. Once we transition them over into corrective care, we add adjustments to their care. Adjustments help relax the muscles and align the spine in neutral position. And then we add in a lot of our active care or our passive care to reduce pain, and then we transition over into active care. So this is our active care room, similar to physical therapy. Okay, so we have our vibration plate here, a vibration machine here. So this is a body fitness machine. What it does is it allows the patient to work out without having to move a lot. So it transmits waves or impulses from the feet area all the way up through the spine. It helps with spinal balance. It helps with working out different body areas. It increases blood flow to the area, as well as being shown to increase function of the immune system indirectly through blood flow. We have our bicycle here, which is really good for core stabilization, low back, leg. We have a spinning bike, which is a more advanced bike. We have our ball for stability as well as core strength. We have our ab machine here, another ab machine here. A lot of times we want to increase the core strength of our patients in order to relax their back and their back muscles. So a lot of times when patients have been injured with back injuries, their core becomes weak. So a goal of ours is to strengthen and rehab the core muscles in our bellies and our chest area, really our frontal muscles, in order to kind of pick up the slack from the injured muscles in the back. Over here we have our spinalator, which provides a good traction to the back. It allows the back to stretch, and it also helps relax the muscles. So it's a way to mobilize the joints, opening and closing the joint area in order to increase blood flow nutrition to the area in the joint. All right. So we'll walk over here. We have our another type of attraction or massage. We have our chair here. Oops. We'll turn the lights on. All right, so this is our massage traction chair. So the patient sits in here. They're able to control their treatment, okay, by a push of a button. And we like to keep the lights down low in here because it gives a nice therapeutic, relaxed atmosphere. All right, we'll move on to our treatment rooms. We have 2 treatment rooms here. In this area, again, we have 2 rooms. In this area, this is where all the treatment goes down. So this is where the doctor applies the therapies, whether it be electrical therapy, ultrasound, ice therapy, heat therapy, or vibration therapy, as well as the chiropractic adjustment. So this is where everything goes down. As we talked about before, our 4 phases of care is here. So first the patient comes in, they're very painful. Okay, so we do a relief phase of care. Then we have a corrective phase of care. Then we go into strengthening. That's when we go over into that physical therapy room as we talked about. And then we kind of transition over to wellness maintenance care. That's when we invite our patients to come back and just kind of get a tune-up once every 4 months, once every month. Okay, So as you can see here, I have a lovely patient here. Hello.
Hello.
So we're going to kind of just demonstrate a little bit like how a chiropractic adjustment could go. All right, so first what I like to do, we utilize a Thompson leg check technique. So we look at the legs, we determine which leg is short. So as I'm looking at my patient here, hips actually look pretty even, but she does have a slight short right leg. So that's going to tell me that her right hip is misaligned. All right, so I'll have you turn on your left side, your right hip up. Okay, and turn over for me, cross arms for me. Very good. Go ahead and look away. So this is a side posture technique. So we'll just relax a little bit. So again, just want to back up a little bit and just talk about what the chiropractic adjustment does. So here we saw our patient had a short right hip. So that tells me that there is a bony misalignment in the hip area. Anytime we have bony misalignments, we also have muscle imbalances because we have muscles that are attached to those bony areas. So this is the spine here. So where I'm going to adjust on this patient is here in the hip area. So I'm going to go ahead and mobilize that area and relax those muscles as well as realign the hips. So our goal in chiropractic is to get everything in center. When we find vertebra in the spine, as we saw here, that are misaligned to the right, misaligned to the left, our job is to bring them in neutral position. Good? Now during the chiropractic adjustment, you'll hear a snap or a crack. Go ahead and move over and turn your belly for me. We'll recheck the leg. So you hear a snap or a crack. That just simply means that that area or that joint, very good, leg check, legs are even. So it tells me that her hip was evened out. So that snap or crack that you'll hear or feel when getting a chiropractic, oh, there was one. When getting a chiropractic adjustment, just do some gentle stretching. That is the release of gas in the joint space. So it's actually a good noise. It's not evidence of anything breaking or fracturing, and it does not increase any pain in the patient. It's actually very relaxing. Doing okay? Mm-hmm. So I'm just doing a gentle mobilizing stretch here on our patient. And this is stretch and relax the muscles before adjustment. Any tenderness in here?
Yes.
Is that a yes?
Yes. Okay.
I'm going to utilize a gentle drop adjustment in my back. You feel the table drop. Doing okay?
Yes.
We're going to do 3 consecutive drops. So my goal here is I palpate and I find a spinal misalignment and I go in and I correct it. We call those spinal misalignments subluxations. So our job as chiropractors is to eliminate these misalignments and realign the spine into neutral position. Go ahead and take a deep breath in for me. Blow out. Good. So see, that was very therapeutic and relaxing for my patient. Good. Doing okay? Wow, interesting. Doing all right?
Yes.
Got a lot of movement there.
Yes.
All right, go ahead and look up for me. Good. Back to center. Doing okay?
Yes.
Go ahead and relax. How you doing?
I feel great.
Awesome. So again, looking for tension up in the upper muscles and shoulders and just mobilizing where we feel restrictions. Okay, got some great movement on that other side. And look up for me. Good. Oh, relax. All right, I'm going to have my patient turn over on her back, bend her knees, and adjust her neck. we move around and we figure out where the misalignment is, hello, and we adjust there. So I'm feeling for bony misalignments. I'm looking to see if the vertebra or bones are to the right or left, so I can so I can move them to the center. I'm also feeling for muscle tension and muscle tone. That also tells me where bones are misaligned as well. Because again, as we said before, the muscles are attached to the bony areas, and if the muscles are pulled or spastic, either to the far right or far left, we can feel that muscle spasm. Okay. Go ahead and drop the shoulder, relax. Simple as that. Doing okay, patient? Good. Go ahead and sit up for me. Feet here. How you feeling?
I feel great.
All right. Let's see what's going on this right side. Okay, good. Just relax. All right, so that's pretty much it. That's your basic chiropractic adjustment. You doing okay, patient?
I am.
Awesome. Thank
Feel
you so
great.
much.
Thank you.
All right, so that's our basic body scan and adjustment protocol. So as you can see, it's very relaxed. The patient was relaxed. We did hear the cavitations or the movement in the vertebra. Again, that's just an indication of gases being released in the joint, which is a good sign of relief and pressure. Something else I want to go over. Again, we do pain care as well as injury care. So we do treat patients that are in pain. However, the other aspect of that is we also treat patients for preventative or wellness causes. So I'd like to bring your attention to this chart here. I like to educate my patients on this because it shows different areas in the spine as well as the spinal nerves that are aligned with body systems. So not only do we adjust in order to help with pain management or pain relief, but we also adjust for systemic care. So for example, when we look at here, we have the heart here, the heart organ, and that points to the area in the spine. We call that T4. That's in the thoracic region of the spine. So research has shown that patients who have subluxations or misalignments, we can use those synonymously. Patients that have subluxations or misalignments in the T4 area may have an arrhythmia or an irregular heartbeat or may suffer from hypertension or high blood pressure. So there has been studies where patients have been adjusted in this region and they are able to regulate their blood pressure indirectly as well as regulate their heartbeat. Other areas, larynx, trachea, bronchi, lungs, T2 area, so our asthmatic patients can benefit from that. Urinary bladder, external genitalia, so areas in the lower sacrolumbar area have been linked to genitalia. So if we have a male with erectile dysfunction, there's been studies that has been reversed, as well as incontinence, so enuresis in our children. We've had some great success with that, adjusting our children that actually bedwet. Other systems that can be affected, hair growth, pancreas, liver, kidneys, intestines. So this is all through research. Eye function, blood restriction going through the vessels. So there's just a host of systemic benefits that we want our patients to know about outside of pain care. So that's all I have for today. We are here located at 927 South Goldwyn Avenue. Our phone number is 407-574-8542. I can be reached via email at drbaker@worldhealthwellness.com. Thank you for visiting.